The federal government says progress has been recorded in eliminating neglected tropical diseases, with approximately 30 million Nigerians receiving ivermectin treatment for Onchocerciasis, river blindness, and Lymphatic Filariasis. Dr. Godwin Tadum, Director of Public Health, Federal Ministry of Health and Social Welfare, made this known at the NTD stakeholders meeting in Abuja.
Nigeria will continue to record a steady progress as far as elimination of NTDs is concerned in this country. I'm aware, and I'm very much happy to know that you have been able to target. In Nigeria, we have about 774 local government areas, and you have been able to succeed in about 379. This is a good achievement so far. And by so doing, you have reduced the burden of those people at risk, still living on these drugs called ivermectin. This is a good one, but we still have a lot to do as far as Nigeria is concerned.
Mr. Fatai Oyedira, Director and National Coordinator, NTD Division of the Ministry, while acknowledging Gates Foundation, Site Savers, and other partners, said Nigeria's NTD burden largely represented by Onchocerciasis and Lymphatic.
And today, we can boldly say that we've eliminated Onchocerciasis in 2 states. Everybody knows that, Plateau and Nasarawa. And also interrupted transmission of onco in 9 other states. And we have attained advanced stages of implementation milestone. And we are also interrupting transmission of LF in most of our states. And hopeful that by the end of 2025, LF will have been interrupted in about 379 local government areas out of 583. It is our hope that by the end of this project in September, we will have been able to win about 32 million Nigerians out of ivermectin treatment, which was against the 27 million targeted at the inception of this project in 2022.
Meanwhile, Mrs. Anita Gwam, Program Director of Site Savers Nigeria, said they supported endemic communities in Nigeria for over 20 years with necessary medications for the treatment and prevention of NTDs.
What we are currently focusing on now is to conduct the impact assessments, the surveys, and that is why this meeting is happening today, to discuss way forward gaps of what we have done before and the remaining. Because without the surveys, we cannot move forward, we cannot say Nigeria has eliminated the diseases. And we cannot continue to be treating communities forever. In some states, we have seen very, very good commitment from even the governors, where they have actually provided direct funding to fund NTDs implementation in those states. But more can be done. I want to use this as an awareness for the governors to know that at the last tail, at the elimination stage, they have to come in. Because as they say, when you start something at the beginning, it's very easy, but towards the end, it's very difficult. So resource mobilization is very key, even at the state and community level.
Professor Oladele Okogun, a public health parasitologist based in Europe, said, though much work remains and challenges are increasing, we are encouraged by the dedication of communities and partners.
We have people we call volunteers. Volunteering is no longer popular, who help us to deliver the medicines. Things are getting more difficult, but with the help of the communities collaborating with the team, we get to that level where nobody will need the medicine.